Hi, good evening. My name is Miriam. I'm a student at St. Mary's University. I had an interview with my friend. She's from a different culture from my culture. I tried not to get anybody from West Africa because I know most of us perceive mental health and mental challenges the same way. So I went as far as going to somebody from a different continent. She's from Western Indies, island of Trinidad, Tobago. She's a mom of two, and she has a boy and a girl which are in the age of 19 and 22. So it was kind of a funny conversation because mental health challenges are not something people are very comfortable talking about, especially people from different culture. But I'm glad we had this conversation because I came to know and understand more about her culture and how they perceive mental health, in as much as we have some kind of similarities from where I come from. But this is Trinidad that I'm going to talk about here. So I went as far as asking her. I wanted to know how they perceive mental health, what kind of care they have in plan, or what kind of plan they have in place for patients with mental health challenges. And she told me that in their culture, that when people have mental health challenges, people assume that is a sign of evil befallen the family, either because of what their ancestors did or something the family did wrong, which is more or less like a nemesis. That's how they perceive that. And most of the times people don't like to talk about it because it's a bad stigma. It's a bad stigma that when you have somebody who has a mental health in your family, people assume, oh, that family evil has befallen them. Nobody wants to talk about it. People are not, free seeking for help or going about trying to know what remedy. Instead, what they do is they take the person to their church, and their pastor is known as pundits. Pundits is like a priest of Hinduism, and they conduct a spiritual prayer, which is pogas. In that spiritual prayer, pogas is where what they do, praying and some other rituals they do spiritually to cleanse the person or find healing, which most of the times people are successful. And they don't associate it with any medication because they believe it's not a medical issue. They believe it's a spiritual issue. I asked her also how when they have a patient, or if you're a client, and how do you want to be addressed. So she said if the therapist is a younger person, they always expect the person to address them by uncle if it's a man, or auntie if it's a woman. Regardless, regardless if you're from the same family or not, or related to the person or not related, they address people by aunties and uncles. Is a sign of respect. They don't go by calling people their first name, especially when they are younger. I asked her also what kind of food they have. Say if you come as my client and I want to offer you something, just to make you more comfortable. She said yes, they have food they call dashi, savors, vegetables, sweet potatoes, meat and fish. The only thing they don't eat is pork. That pork is like a no-no for their culture. I also went ahead asking her how they get to know people. How do they relate with neighbors? Do they go about formally inviting people or asking people to become their friend? Like, how do they initiate relationship in a community? So she said, well, everybody needs to know who their neighbor is. People live like in a communal way, in the sense that you look out for my children, I look out for your kids, we look out for each other. Neighbors are assumed to be community, so you are expected to know who your neighbor is. You're expected to look out for them. If something wrong is happening to their children, you're expected to also partake in helping or finding resolution. And if somebody is having something, you know, everybody tends to attend because a neighbor is having something going on, so you're expected as a neighbor to attend your neighbor's events. Same with prayer meetings. That is how they go about building their relationship. So I also asked her about, do you really feel comfortable with eye contact? Is it a sign of disrespectful in your culture? So she said no, that eye contact is not really a sign of disrespect. People have good eye contact. Posture is one thing they like. They read meaning into your posture, the space, touching, hugs, and sometimes eye contact if it's opposite gender. So I asked her also, do they really like people giving them referral for help and stuff like that? She said no. Like I said before, that they don't believe in help from people. They don't believe in going about exposing, you know, what their needs are. They so much believe in being independent, digging out, figuring out what their challenges are and finding a solution to it. So it was kind of interesting because first and foremost, I didn't even know that, you know, people that are in other continents apart from West Africa also have a similar kind of belief my culture has when it comes to mental health, you know. So I was so happy that I went this far. At least tomorrow, if I become a therapist and I happen to have a client from this culture, at least I know 1 or 2, 3 things I could do in order to help me be successful and also give them a befitting referral. All right, I hope I answered most of the questions, and I will continue to do my research on other cultures. It's very interesting thing to learn about people and how they perceive things. I hope you enjoyed my video, and if you have more questions, please post it, and I'm willing to dig more and learn more. Thanks, and have a great day.